Hi there. One of the commonest procedures or the commonest requests we get for procedures is removal of fat from certain parts of the body and body contouring. Very often people will ask us, do you have any non-surgical ways of doing liposuction? And technically, calling something lipo does not mean liposuction. Liposuction actually means making a small cut and sucking out the fat. Now, those techniques have been around for a long time, but let's talk about techniques that would remove fat or decrease fat without liposuction and can be sometimes called laser lipo or laser lipolysis, cryolipo or cool lipo, and things like that. And basically, all those techniques are based on giving energy to the fat cells, killing the fat cells without going inside the fat cells themselves, and letting the body take care of the waste, which is the dead cells. It can happen without many problems, without any problems actually, in terms of flushing the fat out. But the amount that can be done is fairly limited. There is laser lipolysis, which is laser energy that goes into the fat cells, destroys a few cells. The body, its macrophages and its cell wash them away. Now, the same thing can happen with freezing the fat cells and letting them go away. So those are again taken up, eaten up by the body's cells and washed away with the urine and with the body excreta. Now, there are other techniques where without actually sucking the fat, you can kill some of the fat cells. And those are things which are based on radiofrequency. So what you do is you put a radiofrequency probe inside. There are a bunch of machines that do it. One is called Thermitite. Another one is called J-Plasma. Another one is called Body Tight, TITE, and those all are based on radio frequency. They can destroy the fat cells and similarly they can be washed away. The amount of fat that can be removed with these techniques is a little bit more, and in addition to removing the fat, they do not let the skin get loose because there is a skin tightening effect as well. So those techniques are good as well. Now we can talk about liposuction itself. Liposuction is, as the name suggests, is sucking out the fat. There are many techniques that can be used to help you with removing the fat, and those techniques are based on energy. So liposuction, the traditional liposuction is called tumescent, where you put in a lot of fluid, the cells swell up, and then they are sucked out without damaging the surrounding structures. There is something called wet liposuction or dry liposuction or super wet liposuction. Those are less frequently used. We use tumescent liposuction most frequently. A lot of fluid that is prepared with a little local anesthetic, something that prevents bleeding. All that is pushed in, the cells swell up, and then slowly they are pulled out. Now this process can be improved by using either ultrasound or laser or some other forms of energy which can help in removing the fat which is liquefied with these techniques. The most common one of these is called Vaser, which is the name of a machine. It is actually ultrasound-based liposuction. The advantage of Vaser is that, or ultrasound-based liposuction, is that along with the fat, the skin also gets some energy, and it tends to not become as loose as it would otherwise. So the skin can tighten a tiny bit, and usually when you remove stuff from a bag, the bag becomes loose. Now, using Vaser or ultrasound-based liposuction, the skin tends to remodel a little bit, and you will not have it become as loose as it would have otherwise. If you don't do liposuction, if you just do ultrasound-based treatment for the skin, it can become a little tighter as well. Now, the other thing that can do something similar is laser-assisted liposuction, and there are different names to it depending on the machine: Smart Lipo, Slim Lipo, and so on. And they do something similar. They cause a little bit of damage and stimulation of the collagen and also liquefy the fat. So it's easier coming out, and then there will be some remodeling of the skin, making it slightly tighter. But since you are removing the volume also, so the tightness will not be as much, but it will help in not making the skin much more loose than it would be otherwise. There are some radio frequency based devices which do something similar. Again, they tighten the skin a little bit, remove the fat by liquefying it, and the suctioning is the same as any other liposuction. So those are the techniques for liposuction and the assistance that you can get with the other devices. Sometimes we add radio frequency after we've done the liposuction in the same session, and that is targeted for just skin tightening. And that helps a lot when, in some areas which are not quite as tight as they want to be. as you would want them to be, and fat is removed, so they become loose, a little bit more loose. So an intensive radiofrequency treatment with a little needle-like structure, which is like a cannula, not, you should call it a probe maybe, that is put inside. It gives out the radiofrequency energy, and the skin remodels and tightens up a bit. So one of the common questions that we are asked is, what are the benefits of liposuction? The main benefit of liposuction is removal of some fat from specific areas. There is no total body liposuction. However, you can do all the areas one by one, or do 2 or 3 areas at a time, depending on how much fat needs to be removed. The amount of fat to be removed is based on multiple studies which have shown the efficacy as well as the safety of doing liposuction. So you can only do so much, and depending on different studies and the scenario where you do it, hospital, office-based liposuction, clinic-based liposuction, and liposuction where you don't mind being in the ICU for a while, which I would not advise. But if you do what's called a mega liposuction or 20-liter liposuction, then that would be necessary. Again, not advised, but can be done. I don't do it, but there are people who do it, and if someone is doing for massive amount of liposuction, should probably do it in 2 or 3 different sessions, which would make it safer. Now, that is how much liposuction can be done, and the advantage is you will lose some weight and you will get better contouring. So you do it in definite areas. For men, oftentimes it's the abdomen, the love handles, and the lower back. For women, it is often abdomen again and sides, lower back as well. But sometimes they need it more in the upper part of the buttocks and upper thighs as well. Sometimes you need it in multiple places, and as I said, they can be combined as long as the total amount removed is within reason and within the safety limits. So that is how much can be removed. The advantage is better contouring, and sometimes, depending on the technique used, we can actually use that fat for transplantation. If someone wants, some looseness of skin, they want fat to be put in, that can be also done. The technique I use for that is called a water jet liposuction, in which a lot of water is put into the body and it is thrown with some pressure so that the cells dislodge and are sucked out pure without being damaged themselves. And then that can be used to inject here, the breast, or the buttocks, wherever you want to do it. You get very pure fat and very little swelling afterwards. So water jet liposuction is the technique which is the best for these situations. The other technique is micro liposuction, which means very thin cannulas are taken, and with the syringe, with the help of a syringe, you kind of use a little bit of suction and pull out the fat. With that also you can get fairly pure liposuction, fairly pure fat cells, and those can be injected as well. So the advantages of liposuction are: 1, removal of fat, and secondly, if you want to add it, redistribute it, that can be done as well. Now, one advantage I have seen after doing mega liposuctions or fairly large liposuctions, or even a large amount in 2 or 3 sessions, one advantage I have noticed is that patients' or insulin tolerance becomes less, or resistance to insulin becomes less, and some advantage can be gained for people who are diabetic. However, control may be able to reduce the doses of their medications if a large amount of fat can be removed. It has to be done carefully. For diabetics, it's very important that the liposuction itself be done carefully, and once that is done, you can actually reduce some of your diabetic medications. Couple it with the exercise, which should be easier once you've had the liposuction done. Do more exercises. The insulin resistance has become less, and you can very often reduce the diabetic medications or the insulin requirements. Another common question that we are asked is liposuction good for obese people? And my personal opinion is that obese people should probably think of other techniques of losing weight, diet and exercise if needed, and if they are grossly obese, they can have even surgical treatments done, like bariatric surgery. But for overweight people, you can think of doing liposuction as long as you are ready to do some diet and exercise, and after the liposuction or before that, you can reduce your weight. For those people, liposuction would help, and especially in getting rid of fat from trouble areas like abdomen and sides and sometimes arms or sometimes thighs, those can be taken care of liposuction, and the diet and exercise can start before and continue after the liposuction. So obese people, perhaps not. Overweight people, absolutely. Now there are some obese people who start doing, taking care of their body, start doing diet and exercise, and for those people sometimes liposuction of a reasonable amount can be like a push, and they can start on their weight loss journey with one initial push, and that becomes like a positive feedback, and they'll lose more weight, they'll do diet and exercise. Now they can see the effects. Sometimes just diet and exercise, you can have a yo-yo kind of diet, and you can go up and you go down on the weight, and it's sometimes very discouraging. So if you wish, and you're completely convinced that you're going to be doing diet and exercise and have already started, then liposuction can act as a kind of a catalyst or a positive feedback where you get rid of the trouble areas, the fat in the trouble areas, and keep working on your weight loss. Another question we often get asked is liposuction permanent? Now in liposuction we actually remove cells, and till a point of weight gain or weight loss, the number of fat cells are the same in the body, they stay constant. But if you gain a lot of weight, then the cells start dividing as well. Initially they just increase in volume, but they can increase in number as well. So within a reasonable amount of weight loss or weight gain, the number of cells remain the same. If you gain too much weight, the cells will start dividing. So part of it is permanent, and initially if you gain weight after liposuction, say if you're a lady and if you've had liposuction 360, the stomach, the sides and lower abdomen, and then if you gain a little bit of weight, it may come to your breasts or buttocks. But if you do not gain any weight, if you remain constant with your diet and exercise, you should not have any change in any of the areas. Now if you gain a little bit of weight, comes to other areas. If you gain much more weight, even the areas where you've had liposuction can increase in size. So a reasonable diet and exercise program is necessary, or at the very least keep it the same, if not a little bit better than what you had before you had your liposuction. There was a lady who worked with me. She was a nurse practitioner in the US, and she was working with me, and on her way back from a liposuction with me, the first thing she did was have a Big Mac, a big huge burger, and obviously that wasn't something that I advised. Although she did eventually have a nice diet and exercise program and ended up having a beautiful result from the liposuction. But what she did initially was something we do not advise. What is the downtime? And the downtime can be for various things. Let's first start off with the routine things that we usually do. Sitting down and working on your computer, on your laptop, you can do it the next day. If you want to rest a little bit, give it 3-4 days. You can go to the office in 4 to 5 days. If you're traveling from some other country or some other state, you can actually travel back in 3-4 days or even 5 days. If it's a long flight, then give yourself 5 days. If you're traveling from another state, it takes a couple of hours or an hour of flight time. 2-3 days are sufficient. In terms of going to a regular office where you do sit-down work, you can do it as soon as 5 days. More athletic work or more running around work, if your job entails running around and lifting little bits of things, then give yourself 2 weeks. In terms of lifting heavy weights, especially for the areas where you've had liposuction, say if you've had liposuction on the chest, then you cannot do chest exercises for 4 to 6 weeks. Similarly for the abdomen, but you can exercise other parts of your body. In terms of routine things, again, walking you can do the same day. In fact, we insist that you do it so that it prevents any chances of clotting or anything else. So different things, different times for as far as downtime goes. But another thing that people ask is, for how long will I be swollen? And most of the swelling increases up to 48 hours, and it starts going down, and most of it is gone by 2 weeks. But you look at your best in 6 weeks to 3 months. So things kind of remodel, and the skin will contract, especially for younger people, for up to 1 year. So the shaping can keep going on, and you may not be aware of it. So the downtime is short, and you can come for a short stay if you're coming from outside. Have it done, wait for a couple of days and go back. Another question that we get asked about liposuction is it painful? Now liposuction done under general anesthesia is obviously not painful while it's being done. Under local anesthesia it can be a little uncomfortable, We do water jet liposuction where some small areas are required to be liposuction, and the pain is less with that and the swelling is less. But in some instances, laser liposuction is better or tumescent liposuction is better. And in those situations, we often give people some sedation or anesthesia, and it's painless during that time. But even afterwards, the pain is well under control. We give you pain medications, and the kind of pain is more like soreness, like you worked out a lot after a long time. And it's usually not at rest. It's only when you're moving or touching. However, we do encourage you to move. You should not be sitting still after liposuction. It is best to move. You will be given some garments which need to kind of cause some compression and some decrease in swelling. So move, wear your compression garments, and take some pain medications, and you'll be just fine. The pain is not that much. Liposuction and what happens to the scars that are from liposuction. The scars are usually very small, and they are in hidden places like at the belly button or in the panty line, and they're usually less than a centimeter long. They usually resolve very well. Sometimes you may need to help them with silicone gel strips, some ointments, or some massages. But they do take a little bit of time, but they come out very well and can be helped along if someone has a tendency to form thicker scars. And that should do the trick for you. A little bit of injection, little bit of silicone gel. Even for people who have tendency for keloids, it works out well. Some people ask us if compression garments are absolutely necessary after liposuction. And the answer is no, not really. Compression garments help in decreasing the swelling and sometimes keeping the kind of shape that we've given, keeping it compressed and giving that shape while the healing is going on. This is especially important when we are doing sculpting, six packs or whatever sculpting we do. Sometimes compression garments help keep that shape. So liposuction is often combined with the tummy tuck. We call it lipoabdominoplasty. But even more now, we are doing what's called 360 lipo, which means abdomen, lower back, and sides. The advantage of that is that once that part becomes tight, that becomes narrow, then the buttocks and the breasts for women and overall shape for the men looks much better. And having a little bit of weight in the buttocks and breasts with a very narrow waist is obviously aesthetically very pleasing for most ladies. And for men, the chest looking bigger is always a plus. So what are the side effects of liposuction? Well, the side effect, the most common one, is a little bit of bruising, some swelling, and also a little bit of numbness. It doesn't feel like that the part is dead. It feels a little bit less for a while because the small nerves are stretched out when we do the liposuction, but it all comes back. So those are the commonest side effects. Now, complications. The complications for liposuction have mostly to do with contour. It's too much taken out from somewhere. The contour is not as smooth. The skin is a little bit loose because it was a little bit loose to start with, and more has been removed from the area. The other complications can be with thrombosis, a little more bleeding and bruising, and things like that. But they are usually mild, and when done well within safety limits, you have a wonderful result without having to think too much about any complications or side effects later on. Afterwards, later on, it's all safe. It doesn't impact on your life negatively in any way. In fact, not only does it not affect you negatively in any way, you feel much better about yourself, you have better proportions, and sometimes, as I said, some of the other metabolic benefits are there, and gives you a push kind of to do more yourself. It gives you a positive reinforcement, you feel good. So if you are a candidate for it, if you are in good health, you should certainly think about it.